Hello, it's Ariel. I just wanted to make a video about believing your own experience and how to relate that to when you go see your doctor. I have experienced personally many doctors, in my case neurologists especially with my epilepsy, who were not very good at listening to what I was trying to explain to them about what I was experiencing. And since epilepsy is very hard to explain sometimes, different types of seizures, I found that different neurologists had, a better rapport with me. And so it's really important to find one that you do feel understands, if at all possible, to understand what you're going through and to help you to, treat that the best possible. So I guess what I really want to say though is I had the experience of a doctor not believing anything I said. So I think what's really important is at first he did, and I had this experience at a very prestigious clinic with an epileptologist who is an epilepsy specialist, so a neurologist who does only epilepsy. So this guy was very well respected, and when I first saw him, he was very helpful. He believed me. And I think it sounds funny to even say that because it's surprising when a doctor doesn't believe what you say. So one of the things though is that I have tonic-clonic seizures. I explained that to him. I don't have any videos of me having tonic-clonic seizures. I don't have any EEGs, electroencephalograms, which record your brain waves. I don't have any that show abnormalities. So I don't have any abnormalities in my MRI. I've had about 5 CAT scans, no abnormalities. So I've had something like 5 MRIs and about 5 EEGs. So I've had a sleep-deprived EEG and nothing showed up. So what I mean is that you may or may not, with epilepsy, have anything that shows on a clinical lab report that you have epilepsy. Granted, I've had, like I said, about over 100 tonic-clonic seizures, and many people have witnessed them, including doctors and nurses, and they all say they're full-on tonic-clonic seizures, where you fully pass out and have a seizure, and it is an epileptic seizure. So the difference with this doctor is that, yes, he believed me at first, but then I did a video EEG, which is where you are in a room, in a bed, in a hospital, and you have the leads on your head for the EEG, and they have a video monitor on you, and you stay in there for about a week usually. And I did it twice to try to see if we could record some seizure activity in my brain. Well, it didn't happen. The first time I didn't go off my meds. There was a strange reason that the doctor decided to do that, with the fact that I was worried about tearing my shoulder again, because I originally tore my shoulder having seizures, and then I'd had surgery on it, and so I was worried it would get torn again if I had another tonic-clonic seizure, and so we decided not take me off my meds. Well, so the first time I didn't have any seizures. The second time I did it, I didn't have any seizures. We only went off one of my meds because the other one can cause withdrawal seizures. And he was saying that if I did that and I had some seizures, we couldn't tell if I had epilepsy or not because they would be withdrawal seizures and not just regular seizures. So that's an interesting one. But basically, I didn't go off both my meds. So I didn't have any the second time either. After that, he decided that I definitely did not have epilepsy at all, and that I did not have partial seizures, because I had talked to him about the partial seizures that I figured out I had. And I only figured this out not because anybody talked to me or not because any doctor ever asked me anything that made any sense to what I experienced. But I read a book called The Epilepsy Patient and Family Guide by Orrin Devinsky, and it was super helpful because it had patient descriptions of seizures. So there are tons of types of seizures, and this is why I have this channel. I want other people to understand that you're not crazy, that what you're experiencing is actually manifesting in a way that may seem so bizarre, but it is treatable. And that's the main thing. It's not about whether or not it's a bad thing or a good thing. It's just that you need to treat it properly, and to treat seizures, you have to treat them as seizures. So I had the problem then of my doctor saying that I had bipolar and not epilepsy. So this is a very respected epileptologist who decided that I had bipolar instead of epilepsy. And he said that all of my seizures were psychogenic non-epileptic seizures. That's really hard to believe that somebody would say that to somebody who has extremely by the book tonic-clonic seizures for 10 years and then realizes they have very by the book, according to other patients, partial seizures that he agreed, oh my gosh, you definitely have temporal lobe epilepsy because of the types of seizures I have, the type of simple partial seizures I have. They're unusual, often called psychic seizures. They are not psychogenic though. And so the way you treat them is with epilepsy medication. Well, he decided that I didn't have epilepsy at all. And that was really hard for me because I was really trusting him. He helped me get from Depakote to Lamictal, which was a better choice for me in terms of an epilepsy medicine. However, he said that he believed the only reason it stopped my pseudo seizures was because I had bipolar. And the fact is that they use Depakote and Lamictal both now for bipolar disorder, actually more commonly than they use it for epilepsy. So you end up with the fact that my doctor said, oh, you're really doing well on these meds because you actually have bipolar. So that was pretty absurd to say that I had bipolar when I had had tonic-clonic seizures for, at that time, it was about 15 years. And they stopped because of the Depakote and then the Lamictal, and then the partial seizures got reduced with the clonazepam. So he said, well, the reason the clonazepam works is because it reduces your anxiety, not because it actually reduces my seizure activity. Well, I have to say that that is not the case. I have been seen by other neurologists my whole life and after, and, well, since I got epilepsy at 12. And the fact is that I definitely have epilepsy. And to have somebody tell you that, who is in this position of authority and who somebody you trust, if you start working with them and they do believe you at first, then they tell you that it's all in your mind, you actually have a psychiatric disorder, you don't need to work with them anymore, and you need to stop thinking that you have epilepsy. That was not helpful. Very not helpful. And I really want other people to know that if your doctor doesn't believe you, go find another doctor. It doesn't matter how prestigious or amazingly, acclaimed they are. They may or may not get what is real for you. And if they don't believe you, now, if you don't think you have epilepsy, if you think you have psychogenic seizures, that's great. You can get help with that from a neurologist and psychiatrist. But if you think you have epilepsy, or you're sure you have epilepsy, then don't let a doctor tell you that you don't. Because just because it doesn't show up on an EEG does not mean that you don't have epilepsy. There are many people that do not have seizure activity show up on EEGs, and now they are finding that with simple partial seizures, they don't always show up on an EEG. And that was something that was new to me recently. Most importantly, though, believe yourself. Believe your experience. Don't let a doctor dictate what they think your reality is, because you are precious, and if this is what you are experiencing, you need to get help with it. And the only way to get help is to have someone who trusts that what you say is what you feel and what you experience, and that they need to work from there. If they really thought I had psychogenic seizures, well, they needed to make sure I got help and figured out how to stop having psychogenic seizures. But I had been doing everything that possible to try to get help if that was the case, and it didn't help at all. Taking epilepsy medicine is the only thing that has ever helped any of my seizures. So that shows that I have epilepsy, as well as the fact that I fit every possible criteria. But, like I said, sometimes people don't trust you or believe your experience. And I just want people to remember, believe your experience. Don't let anybody say that your experience is not real.